Welcome to the module on helping patients identify adult-oriented physicians. For pediatricians, this includes the identification of an adult-oriented primary care physician and other specialty providers. For family physicians and meds-peds physicians, this means shifting to an adult model of care and identifying other specialty providers. This module describes the importance of identifying a primary care provider, specialists, and other service providers who use an adult model of care. It provides tips and resources for helping families identify adult-oriented physicians. It describes the roles and responsibilities for coordinating the transfer of care, including a discussion about privacy rules and tips for saying goodbye to patients and families. Finally, this module provides quality improvement strategies and ideas to apply in PDSA cycles. Every adolescent transitioning to adult healthcare will benefit from having an ongoing relationship with an adult-oriented primary care provider. This primary care physician should be informed and equipped to provide first contact, continuous, long-lasting, and comprehensive care using an adult care model. This primary care provider should promote continuity of care and integrate treatment for all of the patient's special conditions and general healthcare needs. Transitioning to an adult healthcare model promotes and supports adolescents' social and emotional development, self-concept, self-image, and self-reliance, and independent living, long-term planning, and life goals. It also ensures age-appropriate care, such as screening and treatment for adult health problems, attention to sexuality, fertility, and reproductive health, and coordination with adult-oriented specialty care. Timing is important. Generally, help families identify the new adult care physician within 1 year prior to transfer. Confirm the availability of the selected primary care physician close to the transfer date. For patients with special healthcare needs, inquire about the adult-oriented primary care provider's willingness and ability to coordinate care for the patient's unique medical, developmental, social, and/or environmental needs. For patients with complex conditions, it may be helpful to first enlist the patient's current specialists to identify new adult-oriented specialists so that the new primary care provider has an established network of other providers with whom to consult and share care. These project-developed handouts will help you initiate discussions with families about the need to identify adult-oriented primary and specialty care physicians. Differences in Care describes potential differences between the adult and pediatric healthcare experience and will help families prepare for the new culture of adult care. Finding Adult Providers lists several referral resources and suggests questions to ask potential new doctors before choosing one. Working with Your Doctor provides tips for getting the most out of appointments. Among others, referral resources include referral from the pediatrician based on relationships developed by the practice, the ICAP Illinois Provider Directory for children, young adults, and youth with special healthcare needs, and the parents or guardian's primary care provider. Use the links above to view the handouts before you continue. Here are some general criteria that patients might consider when selecting a new adult-oriented primary care provider or specialist. They will need a physician who accepts their insurance. Particularly for primary care, most prefer a physician who is a reasonable distance from their home, and some must consider accessibility to public transportation. The patient may want a physician who is easy to reach during and after office hours, for example, by phone, by answering system, by website, or by email. Finally, a good working partnership between the physician, patient, and family requires a shared philosophy in treatment methods and goals. Patients with special healthcare needs and their parents or guardian will likely consider additional criteria. First, the adult-oriented physician must be knowledgeable and instill confidence that he or she can meet the healthcare needs of the young adult. Second, the physician must be able and willing to accept the patient's unique challenges. This does not mean that an adult care provider is an expert in the patient's condition, but that he or she is willing to learn basic preventative, urgent, and chronic care needs for this patient. The office staff must also be on board with the unique challenges of patients with special healthcare needs. Third, the office must be physically accessible for patients with mobility limitations. Finally, the patient and family may want a physician affiliated with a specific hospital if they require periodic hospitalization, or if they want all of their doctors to be part of the same hospital or network. As the transition date nears, it is time to take steps to coordinate the transfer of care. This table outlines some suggested responsibilities. The pediatrician should provide relevant, up-to-date medical information and a concise, portable medical summary for the new primary care physician. This course recommends that the pediatrician and adult care physician maintain open communication and determine when responsibility for care will shift to the adult care provider. If possible, the patient, family, and new physician should meet prior to formal transfer to assure suitability of the new primary care provider. The pediatrician may remain available to the adult care provider for historical support and/or consultation for a period of time, but the patient and family need to recognize that they are forming a new, ongoing relationship with the adult-oriented provider. Typically, the pediatric specialist will coordinate the transfer to the adult care specialist. Communicating with the new provider will go a long way toward facilitating a smooth transition. A 2008 survey of adult-oriented providers revealed that 90% wanted to speak with the adolescent's previous healthcare provider. Practice staff must pay special attention to record transfer and privacy rules. HIPAA privacy rules require explicit permission from the patient or parent or guardian for communication of personal health information. In general, when referrals are made among physicians, there is an implied permission for relevant information exchange. However, there may be elements of a patient's history for which healthcare providers must seek explicit permission for information release, such as mental health, substance use, or reproductive concerns. A policy of record transfer directly from the pediatrician to the new adult care physician preserves confidentiality of patient information. The following AIM statements express optimal care for this KCA. Discuss the need to identify an adult-oriented primary care physician for 70% of patients 17 years or older, and discuss the need to identify adult-oriented specialty physicians and/or other service providers for 70% of patients 17 years or older. The corresponding chart review questions are listed on the right. See the Aims and Measures grid for complete measure information. Do gaps in your practice exist around helping patients and families identify adult-oriented primary care physicians? Here are some potential barriers and improvement ideas to consider, but there are more in the Barriers and Ideas for Change grid. Refer to your printed copy of the grid as you work through PDSA cycles to test ideas that you and your staff think will work. Here are some resources to help families identify adult-oriented physicians and other providers. These include the Illinois Provider Directory for Children, Youth, and Young Adults with Special Needs, several project-developed handouts for families, and various consent and confidentiality resources. Before we close this presentation, it is important to address a heartfelt subject: saying goodbye to patients. Pediatricians do a great job of building close relationships with patients and families, but often give little time and attention to managing the termination process. Once you have helped the family identify new adult care physicians and have arranged for the transfer of the patient's medical records, now what? Take care while saying goodbye to promote positive feelings for the process of becoming an adult. Avoid negative feelings of loss, anger, or abandonment. Provide closure so the patient can establish a new, satisfying relationship with the adult care physician. Assure patients and families that you will help them facilitate the transition of care and remain available for consultation with the new provider. Consider getting creative and celebrating the patient's transition with a handwritten note, token gift, graduation ceremony, certificate of completion, or other rite of passage.